All right, let's talk about a big one for anyone dealing with serious back pain: epidural steroid injections. They're a super common treatment, but man, they can come with a lot of questions and concerns. So, we're going to cut through all that noise and look at the actual evidence for two of the biggest worries people have: bone fractures and infections after surgery.
So maybe this sounds familiar. You've done the physical therapy, you've tried the other treatments, nothing's really working, and now your doctor's brought up getting an ESI. But then you go online, you hear stories, and you start to wonder, wait, is the cure worse than the disease here? If that's you, you are in exactly the right place.
Okay, so let's just make sure we're all on the same page. An epidural steroid injection, or ESI, is pretty much what it sounds like. It's a shot of a strong anti-inflammatory steroid that goes into the epidural space. That's the area right around your spinal nerves. The whole goal is to calm down a pinched or irritated nerve that's causing that shooting pain, or radiculopathy. So, in this explainer, we're going to dig into the science behind two of those big concerns. First up, what does this do to your bones?
Okay, let's just jump right in and tackle the first huge fear people have. Could a treatment that's supposed to help my pain actually be making my bones weaker?
So this is the big one. This is the myth we're going to investigate, and it makes sense why people worry about this, right? We've known for a long time that taking steroid pills for a long time can weaken bones and cause osteoporosis. So the question becomes, does injecting it right near the spine do the same thing?
Well, the short answer is, it's really complicated. The science is all over the place, and it is definitely not a simple yes or no. The risk isn't the same for everybody. In fact, it changes a lot based on your own health and how many of these injections you're getting. So really, this means we have to stop asking, is it risky, and start asking the much better question, what is my personal risk?
So, to really understand what's going on, we need to pop the hood and look at the actual evidence. Let's break down how scientists measure bone health and what the research has actually found.
Okay, so the key measurement here is something called bone mineral density, or BMD. Just think of it as a score for how strong and dense your bones are. But here's the wild part, and what's really important on this slide. Your fracture risk is super sensitive to even tiny changes. Get this, a drop in your bone density of just 2% can crank up your risk of a fracture by a shocking 20 to 30%. It's a huge multiplier.
And this number right here, this is exactly why there's a real concern. One study that used special CT scans looked at patients who got at least 3 injections over a 5-year period. And what they found was that their spine's bone mineral density was, on average, about 20% lower than a similar group of people who didn't get the shots. That is a major drop, and it shows why this is a question we have to take seriously.
So, the big question is, who's most at risk? Well, the research points to a few really clear factors. The risk seems to be higher for groups we already know are at risk for bone loss, like postmenopausal women. It's also about the dosage. Getting more than, say, 3 injections in a year seems to be a tipping point in some studies. And of course, it makes sense. If you're already starting out with low bone density or osteoporosis, you just have less of a safety margin to begin with.
Okay, so that's the whole story on bones. But for a lot of people, the injection is just one step in the journey. If spine surgery might be in your future, a whole other question pops up. So let's tackle myth number 2, the risk of infection.
And this fear makes a lot of sense, right? We know steroids suppress the immune system. So if you get an injection, and then a little while later you have surgery in that exact same spot, does that make it easier for a nasty infection to take hold? This is a huge, huge question for patients and surgeons alike.
And just like with the fracture risk, the reality is so much more nuanced than the myth. The research absolutely does not show a higher risk for any and all spine surgeries. Not at all. Instead, what the evidence points to is a possible, and I should say modest risk, that seems to depend almost entirely on 2 things: the specific type of surgery you're having and the timing of that last injection.
So let's break that down, because this is really important. To understand this risk, you first have to understand that not all back surgeries are created equal.
Broadly speaking, you can put them into 2 buckets. In one bucket, you have what's called non-instrumented surgery. Think of things like a microdiscectomy or a decompression, where the surgeon is mostly just removing a bit of bone or disc. These tend to have a pretty low infection rate to begin with. But in the other bucket, you've got instrumented fusion surgery. This is a much bigger operation where they're actually putting in hardware, screws, rods, to fuse your vertebrae together. And as you can see, these surgeries already have a much higher baseline risk of infection even before you ever think about an ESI.
Okay, now this is where it gets really interesting. What happens when you add a pre-op ESI to the picture? Well, for the simplest surgeries, like a microdiscectomy, we honestly just don't have enough good data. For decompressions without fusion, the evidence is a total mess. It's conflicting. But look, the only place where the research shows a consistent, clear signal is for the biggest surgeries, the fusions that involve hardware.
And this right here brings us to maybe the single most important factor in this whole discussion: timing. For those big fusion surgeries, that potential bump in infection risk seems to be trapped in a very specific window of time. Multiple studies found the risk was highest if the injection was given within a month, 30 days of the surgery. That risk might linger for some people up to 3 months out, but the key thing is, once you get past 3 months, that increased risk seems to totally disappear.
Whew, okay, so we have unpacked a ton of science on both fractures and infections. Now we get to the most important part of all. What on earth does this all mean for you and your decision?
Because this isn't just some academic exercise, right? This information is a tool. It's something you can use to have a way smarter, more informed conversation with your doctor about whether an ESI is the right move for you in your specific situation.
So if there's one thing I really want you to take away from all this, it's this. There is no one-size-fits-all answer here. Your risk is not your neighbor's risk. Your personal bone health, your BMI, any other conditions you have, those are massive factors. And if surgery is even a possibility, timing is absolutely critical, especially if it's a fusion. But ultimately, this isn't about just saying yes or no. It's about weighing these very specific, nuanced risks against the very real pros, like the chance that an ESI could give you enough relief to avoid surgery altogether, which is a huge win.
So, knowing all this, you can move past the simple general question of, is it safe, and start asking much better, more targeted questions. Questions like, okay, given my personal bone density, what does my risk profile actually look like? Or, if a fusion surgery might be in my future, how should we be thinking about the timing of any injections? That is the kind of conversation that leads to the best possible care for you.